Yeah, so I think that's a really good question in terms of where checkpoint inhibitors combining with tyrosine kinase inhibitors really are going. I think this is a rapidly evolving landscape. There's multiple partnerships with different types of tyrosine kinase inhibitors with different types of immune checkpoint inhibitors. So for example, there's an ongoing phase 3 study that's really combining a tyrosine kinase inhibitor known as lenvatinib, which previously has been shown to have activity in frontline setting for advanced HCC, and combining that with immune checkpoint inhibitors such as pembrolizumab. And that ongoing phase 3 study, the LEAP-002 study, is really looking at whether or not the combination of lenvatinib plus pembrolizumab will lead to superior outcomes in terms of progression-free survival as well as overall survival versus lenvatinib by itself. In addition, there are other tyrosine kinase inhibitors. So here at GI ASCO, we looked at preliminary data with regorafenib plus pembrolizumab. This was a phase 1 study that was being done at multiple centers. And what they showed was that response rates were close to 30%. So very similar to what was shown in the phase 3 setting with IMbrave150. So the question is really, is that enough to ultimately proceed to a phase 3 study with that combination? In addition, there are other combinations that are being looked at, not only with PD-1 immune checkpoint inhibitors, but with PD-L1 immune checkpoint inhibitors. So atezolizumab, which has already demonstrated efficacy, as I mentioned, with a monoclonal antibody with bevacizumab through IMbrave150, is now potentially being combined with a tyrosine kinase inhibitor such as cabozantinib. So there is an ongoing study known as COSMIC 312 that is really looking at frontline atezolizumab plus cabozantinib versus sorafenib in the frontline setting, as well as an exploratory arm of cabozantinib in the frontline setting as well. So I think it's very complex. There's multiple pairings. It's really trying to kind of, all the TKIs and immune checkpoint inhibitors are essentially dating each other right now, and you're ultimately trying to find the happy marriage that's going to lead to the best response for those patients.